This is part 2 of chapter 7, the cardiovascular and lymphatic system. So this is a picture of a myocardial infarction. You can see the darkened area there where a death of the heart tissue occurred due to a coronary artery occlusion. So we're going to continue the symptoms and medical conditions. Peripheral arterial disease, PAD, is a disorder of the arteries outside of or peripheral to the heart. Plaque is the fat or lipid deposit on the arterial wall. Polyarteritis is an inflammation of many arteries. Raynaud's disease or Raynaud syndrome is cyanosis of the fingers or toes due to vascular constriction, and that's usually caused by cold temperatures or emotional stress. Here is a photograph of Raynaud disease as indicated by the pallor or the white areas on the ends of the fingers. Rheumatic heart disease, or RHD, is a valvular disease resulting from rheumatic fever. Stenosis is the narrowing or stricture of a vessel. Thrombus is a blood clot. These are terms related to heart rhythm and conduction disorders. So arrhythmia is the abnormality or disturbance of heart rhythm. Bradycardia is a slow heart rate. Dysrhythmia is a defective heart rhythm. Fibrillation is the rapid, irregular muscular contractions of the atria or ventricles. And here you can see some common types of arrhythmias shown through electrocardiogram tracings. At the top is a normal sinus rhythm. Underneath that is bradycardia. Underneath that, so bradycardia is a slow heart rate. Underneath that is fibrillation, ventricular fibrillation, and that is the rapid or irregular muscular contractions of the atria. This is the ventricles. Atrial flutter is a rapid regular muscular contraction. Premature PVCs, premature ventricular contraction. That's an early contraction of the ventricles. And tachycardia, there is a sinus tachycardia. Additionally, flutter, I talked a little bit about that, regular muscular contractions of the atria or ventricles. Palpitation is the forceful or irregular heartbeat felt by the patient. Premature ventricular contraction, or PVC, is an early contraction of the ventricles, and tachycardia is the fast heart rate. Terms related to the disorders of the veins. A DVT is a deep venous thrombosis. That's a blood clot formation in a deep vein, usually of the legs or the pelvic region. Phlebitis is an inflammation of a vein. Telangiectasia is a dilation of small or terminal vessels. Thrombophlebitis is an inflammation of a vein with a formation of a clot. And varicose vein is a swollen or twisted veins, usually of the legs. So there's a photograph of some severe varicose veins. Terms related to the lymphatic system. Edema is the accumulation of excess fluid in intercellular spaces and can be caused by a blockage of lymph vessels. Elephantiasis is the enlargement of the lower extremities due to blockage of lymph vessels, commonly caused by filarial worms or filariae. Filariae are small parasitic worms that are transmitted by mosquitoes, and the worms invade tissues as embryos and block lymph vessels as they grow. So here's a patient with advanced elephantiasis. Additional terms related to the lymphatic system. Lymphadenitis is the inflammation of the lymph nodes. lymphadenopathy, always a hard one for me, is a disease of the lymph nodes, usually causes enlargement of the nodes. Lymphangitis is the inflammation of a lymph vessel. Lymphedema is the edema due to blocked lymph node or lymph vessel. Pitting edema is the edema that retains an indentation of a finger that's been pressed firmly on the skin. So here's a palpitation on the foot. In the picture on an A, they're pressing on the foot, and you can see where they pressed there and the skin didn't flex back. That's what's called pitting edema. So let's talk about some common tests and procedures related to the cardiovascular system. So cardiac enzyme test is the blood test used to measure the cardiac enzyme levels. And when the levels are increased, this may indicate a myocardial infarction. Cardiac troponin is a blood test used to measure the level of a protein that's released in the blood when myocardial cells die. C-reactive protein, or a CRP, is the blood test used to measure the level of inflammation in the body, and this may indicate conditions that lead to cardiovascular disease. An electrolyte panel, that's the blood test used to measure the level of sodium, potassium chloride, and carbon dioxide, and it's used to diagnose the acid-base or pH imbalance that may cause arrhythmias, muscle damage, or death. The lipid panel, or a lipid profile, is a blood test used to measure the level of total cholesterol, high-density lipoprotein, low-density lipoprotein, triglycerides, and all of which may be indicators of increased risk of cardiovascular disease. And these are some studies or imaging studies related to the cardiovascular system. So an angioscopy is the insertion of a catheter with an attached camera to visualize a structure or vessel. Arteriography is the process of recording an artery after the injection of a dye. And coronary angiography, or cardiac catheterization, is the process of recording the heart and major blood vessels after the injection of a dye. Here's a picture of a coronary angiography. Additional imaging studies related to the system cardiovascular is MRI, or a magnetic resonance imaging. That's an imaging technique that uses magnetic fields and radio frequency waves to visualize anatomic structures. An MRA is a magnetic resonance angiography. It's an MRI of the heart and blood vessels with an injection of a dye. And an MUGA is a multiple uptake gated acquisition scan. And that's a nuclear medicine technique used to assess ventricular function by producing an image of the beating heart. Sonography, or ultrasonography, uses ultrasonic sound waves to visualize internal organs. So a Doppler sonography, a DS, is a technique used to record velocity of blood flow. Echocardiography is a process of recording the structure and function of the heart at rest and with exercise. And a vascular sonography is the placement of the ultrasound transducer at the tip of a catheter within a blood vessel to assess blood flow. So here's a picture of someone getting an echocardiography. Additional studies related to cardiovascular systems include the SPECT scan, that's a single photon emission computed tomography, and it's a nuclear medicine technique used to assess ventricular function by producing a three-dimensional image of a beating heart. A monography is the process of recording a vein after the injection of a dye. A ventriculography is the process of recording the heart ventricles after injection of a dye or a radioactive substance like a radionuclide. Additionally, auscultation is listening to the body sounds with a stethoscope. A stethoscope is an instrument used for auscultation of vascular or other sounds in the body. And a blood pressure monitoring, or BP, is the auscultation of the systolic and diastolic arterial pressure using a stethoscope or a sphygmomanometer. A sphygmomanometer is the device used for measuring blood pressure. Percussion is the physical examination method of tapping over the body to elicit vibrations and sounds to estimate the size, border, or fluid content of a cavity. Your pulse is the rhythmic dilation of an artery within each heart contraction and usually felt at the wrist or neck. Additionally, in ECG or EKG, electrocardiography is the process of recording in a graphic format the heart's electrical activity. The waves are labeled with the letters P, Q, R, S, and T. A graded exercise test, a GXT, is a stress electrocardiogram exercise test, and it's performed with controlled stress, usually on a treadmill or a bicycle. A Holt monitor, or HM, is a portable electrocardiographic device, usually worn for 24 hours, but it could be worn longer. Surgeries related to the heart. A cardiac pacemaker is the surgical placed mechanical device connected to stimulating leads or electrodes on or within the heart, and it's programmed to help maintain normal heart rate and rhythm. Pericardiocentesis is the surgical puncture to aspirate fluid from the pericardium. A valve replacement is the surgical replacement of a valve with a biological or mechanical device, and there are certainly lots of figures of these in the text. Here's the insertion of the pacemaker. You can see the little round pacemaker generator placed beneath the skin in the pectoral region, and you can follow the leaded tunnel to into the apex of the right ventricle. Here is a mitral valve prosthesis. That's a mechanical heart valve. Surgeries related to the blood vessels or angioplasty. It's a surgical repair of a vessel. An aortocoronary bypass, or ACB, is the attachment of a grafted vessel to the aorta to ground a damaged coronary artery. Aneurysmectomy is the excision of an aneurysm, and atherectomy is the surgical removal of that fatty plaque from a vessel surgically or using a catheterization. A CABG is a coronary artery bypass graft, and that's a surgical procedure in which the damaged section of a coronary artery is replaced or bypassed with a graft vessel. An embolectomy is the surgical removal of an embolus or blood clot, usually with a catheter. An endarterectomy is the surgical removal of the atheromatous deposits, usually in a coronary or carotid artery. Here's a picture of a CABG, and you can see where they've grafted a vein to bring into the heart. PTCA is the percutaneous transluminal coronary angioplasty, and that is the advancement of a cardiac catheter with a balloon attachment that's inflated at the site of the stenosis, enlarging the lumen. A phlebectomy is the incision of a vein. A stent is an intravascular insertion of a hollow mesh tube designed to keep a vessel open or patent. Here's a picture of the coronary angioplasty, the PTCA. An arterial stent, you can see the balloon catheter with the expandable stent, and that's placed against the arterial wall. Additional surgeries or procedures. Cardioversion is the use of defibrillation or drugs to restore the heart's normal rhythm. Defibrillation is the use of the electric shock to stop fibrillation or cardiac arrest. For surgeries related to the lymphatic system, an adenectomy is an excision of a gland. A lymphadenectomy is an excision of the lymph node, and a lymphadenotomy is an incision of the lymph node. And here's some common medications and drug therapies. Antiarrhythmic agent suppresses fast or irregular heart rhythms. Anticoagulant prolongs clotting time. Hemostatic agent stops the flow of blood within vessels. Hypolipidemic agents lower cholesterol levels. And nitroglycerin is a vasodilator used for angina pectoris. Thrombolytic therapy, vasoconstrictor, vasodilator, look those up. And these are the specialists: cardiology, cardiologist, cardio-electrophysiology, and a cardiac electrophysiologist. You can review this in the book. lymphedema